Hey guys, so I had been thinking of remaking my addiction and religion video, but I decided I actually want to talk more about mental health broadly and religion overall. I'll mainly be going over three things in this video: religious addiction treatment, like in the original video, religion in group settings, such as group therapy and hospitalization, and individual religious counselors. Obviously, I am not a mental health professional. I am just someone who has a history in this type of setting. So while I will be providing sources where they're needed, please do not take this as medical advice and ultimately listen to what your licensed mental health professional says over my word. So let's just get into it. This video will be divided into chapters covering each of these topics, so feel free to skip around if you're not interested in one or the other. But to start off, I want to readdress some of the stuff in my old video. Whenever I say religious addiction treatment, I don't mean being religious while in recovery or even working your religious beliefs into actual therapy, but specifically treatment from religious organizations or groups that utilize theistic ideas as a main part of the recovery process, such as the 12 steps. To start off, studies indicate that AA, or the 12-step program, has a success rate between 5 and 10%, with around 1 in every 15 people staying sober. I'll admit it would be unfair to blame this entirely on the inclusion of theistic ideas. Past studies have struggled to identify causality and success rates regarding religion either positively or negatively, so I won't outright state that this is due to theism as opposed to other factors such as accountability, community, or the level of care. However, that being said, I can say that religious addiction treatment statistically results in a higher level of religiosity in studies examining it over a period of active treatment, discharge, and 6 months post-treatment. This type of treatment is often given from a Christian perspective, and often from an unqualified group leader as opposed to a licensed therapist and medical professionals. While I think it'd be a bit unfair to say all of these organizations have ulterior motives, conversion is a core theme among many sects of American Christianity, and indoctrination is often most effective in individuals who are vulnerable or desperate. A big issue with this is that religious treatment is often the only option for many people. It's often free and it's easily accessible as opposed to secular and medically proven options due to both cost and location. As mentioned previously, indoctrination is most effective among vulnerable individuals. This is part of why children are most successfully indoctrinated, along with inmates, addicts, and people who are stricken by areas that have poverty and disaster. Many types of charity conducted by churches, such as mission trips to the Global South, disaster cleanups, food banks, and homeless shelters, require some level of cooperation with being proselytized to. It's very rare that there is a no-strings-attached situation, and it targets people in a position where saying no is not really an option. While not all religious charities operate this way, many homeless shelters require you to follow a certain level of religious rules and beliefs in order to use their services, such as the Salvation Army, where this extends to denying service to trans people as a whole. Many food banks run by churches will hold sermons and pass out Bibles, and many church-based addiction centers put heavy emphasis on prayer and faith over things like harm reduction or improving the core issues that addiction often stems from, such as other mental health conditions, poverty, and trauma. Because of this, help is not only conditional, but because it targets people who are desperate and vulnerable, it's more likely to result in lifelong converts as opposed to simply sitting through it. Not only is the work often insufficient or unqualified, but it's thanked for being as such and remembered as a reason that they hold their faith. So to come back to addiction specifically, I'll restate that I think it'd be unfair for me to attribute the low success rate to religiosity, as studies struggle to assign correlation either positively or negatively, but I can comfortably say that it's usually done with ulterior motives, and that often comes at the cost of diverting energy from the actual treatment itself into the aspect of either conversion or strengthening faith. I don't personally find any value in religion. I don't think any of its positives can't be achieved equally as effectively as they could from an irreligious person. But with that being said, I'm not going to outright say that having your religion be a part of recovery is just always bad. I think it'd be better if you moved on from it once you're in a more stable position, but ultimately sobriety is sobriety, and that's not really my call to be making on others' behalf. I just don't think it should be a core factor in how that recovery is achieved. Like I said before, part of the reason that many people who are not religious or are just passively religious turn to this type of treatment is because of its availability. Going to sit in a church basement or speak to a pastor is free, and there's churches on every corner in many parts of the country, whereas rehab and therapy, along with non-abstinence-based approaches focusing on harm reduction, are often either expensive or not even available in the area. Some cities in the US and Canada have started introducing safe injection sites, where clean needles are provided so that people don't reuse them, along with nurses and healthcare professionals, and resources to receive treatment if that's what the person wants. I think ultimately not only destigmatizing addiction and therefore its treatment, but creating more secular options for safer use as well as recovery are far better solutions to this. While there is free and non-profit secular addiction treatment, it's not nearly widely as available as a church is. Supporting these facilities that do exist allows them to grow and be available to more people. Ultimately, I think focusing on those institutions as opposed to arguing that, like, a church is better than nothing because it helps some people, even when it comes at a cost, is far better of a solution. To move on from addiction treatment, I want to talk about how religion is used in group therapy settings, particularly psych wards and IOP and PHP programs. I'll admit when jumping into this area that this is based on personal opinion and experience, but it's coming from someone who's been admitted to the psych ward more times than I can fit on both hands. It reflects my experience in the psych ward. Before I go too much into my own experiences and my issues, I do want to note that while I'm obviously not a fan of religion, I absolutely think all religious beliefs should be accommodated while in a psychiatric ward, whether that's clothing or food or prayer or the like. I'm not saying that those things should be removed or changed. My experience with the psych ward and religion was kind of as follows. Religion is discussed in actual therapy in vague terms that include pretty much any major religion, but do not account for being irreligious. You're allowed to be exempt from the conversation or topic, though in my experience, some nurses and techs will take the dismissal as non-compliance, which can lengthen stays. However, it's often ignored when other patients attempt to force their religion on others unless that patient is of another faith. I personally witnessed repeated interactions between two patients. I don't remember their names, nor would I share them anyway, so I'll call them A and B, in which A was a very, very religious woman, and B was more outwardly vitriolic towards religion than even I am. B was never rude about religion unless A pushed it on her, and A often carried around a Bible with her and would try and read verses or pass it on to B. B repeatedly complained to staff about this and was told to just let her be and that she didn't have to read it or agree with her, but basically just let it go. The only time staff ever intercepted this repeated proselytizing was whenever A said something along the lines of premarital sex is a sin in group to B, and B gave a snarky response and was hit on the head with the Bible. The response was only a result of the physical touching, not the initial comment or the repeated past comments. This behavior continued the entire time I was there, and also extended to me at one point. I drew Baphomet during art therapy and was told it was offensive to A, and was told to either redo the assignment or sit out of group, despite the art therapist himself finding it funny and actually it being a tech that scolded me. This is ultimately a bigger issue outside of mental health care, where religious belief is inherently seen as worthy of being shared or at least excused by being religious, even to the discomfort of others. But responding to those beliefs with disagreement or frustration, even when they're forced on you, is seen as offensive or disrespectful. Even regarding the fact that her proselytizing to someone of a different faith was not tolerated, but doing it to me or B was acceptable because it wasn't infringing on our own religious beliefs. It was simply rude, obnoxious, and because we were in the psych ward, unable to be avoided. This also extended to the fact that, while I admire that they made an attempt to include any religion when discussing how people may include faith in their recovery, the idea of being irreligious was seen as non-participation. I was often told not just to not answer the question or say I don't believe in that or I don't think it's helpful to me, but to basically either make something up in the place of a higher power or to think about it hypothetically, even if I don't actually think it's real. This did admittedly depend on who was running the group, but I don't think the fact that it happened at all was appropriate. This brings me to the idea of religious trauma. My partner is currently in an IOP program, and while religious questions were optional, because of his own history with religion, he was still made uncomfortable by their inclusion. Not only is the inclusion of religious talk in a group therapy setting often off-putting or non-inclusive to irreligious people like in my situation, but it can be triggering for people with religious trauma and make people feel like the environment is unsafe or untrustworthy. While I think it's totally acceptable and can even be good to allow people a space to include their faith in their recovery and give accommodations where it's needed, religion should not be discussed in the actual group therapy, and there should be an expectation that those religious beliefs are held privately, not just for patients of other faiths, but for anyone. You want to pray over your shitty hospital food? Go for it, but if you ask others to participate or you repeatedly discuss it, nope. You want to work God into how you plan to stay sober, take your medication on time, or manage your relationships? That's totally fine. Just don't, as a therapist, include that as part of the session when you're in a room with 12 patients whose backgrounds you don't know. The last thing I want to discuss is individual religious counseling. And I want to clarify here again that I don't mean talking to your therapist about your religion. I don't mean working your religion into how you recover. And I don't even mean licensed therapists whose focus is on treating Christian patients or taking a biblical approach while still using proven therapy methods. I mean seeking mental health support from a pastor or a specifically designated religious counselor who is not a psychologist. This section will be a bit shorter because honestly there's not a lot to say about it, but while seeking out a religious leader for basic support when you're stressed or issues that are faith-related is totally understandable, that is not the same thing as going to a religious leader for mental health issues, relationship issues, or anything else that's usually handled by a therapist. These people are not educated on this. They don't have the ability to provide that level of care. Hell, even if your pastor is a psychologist, because you are not their patient, things like HIPAA and maintaining boundaries that are required when you're recognized as someone's patient will not apply to this person. I've heard horror stories of people seeking support, especially when they did something wrong, and having a pastor build a sermon off of essentially vaguing your issues to the whole congregation. They also just don't have the ability to give you the actual help you need if you're struggling with serious mental health issues. They cannot refer you to psychiatry to be medicated or even know if you would benefit from medication. They do not use proven types of therapy such as CBT and DBT. They do not have the same bedside manners as a medical professional and may give harmful advice or overshare details about their own life that's unhelpful or even damaging. They may share other people's information who's come to them in the past and as such do that with yours, even if not by name. And even the best, most compassionate, genuine pastor who doesn't do any of that, who gives great advice, doesn't share a word with anyone, is still completely unqualified to be giving you mental health help. I understand that there are situations where someone may not be able to access any type of therapy, so a pastor is their only option. And if that's the case, this section isn't about you or those people, but many people choose to seek religious counsel over mental health treatment, and that can be so damaging to their own health, as well as often how they approach their relationships. Another very public example of this is Kristen and her husband Dave from Girl Defined. Her husband has shared that he really wanted her to get therapy. They're wealthy, they can afford therapy, but she chose to seek religious counsel while her husband went to a real therapist because of the narrative in her religion that therapy quote-unquote keeps you sick and quote tells you that it's not your fault instead of admitting that you've sinned, sentiments that she's expressed in the past. These mindsets are deeply damaging, and another related example of that is Pauline Morgan. Morgan has publicly stated that she has BPD, something that I also have and know requires serious mental health treatment. Yet she's repeatedly yelled about how Jesus cured her and how you don't need therapy or medication, you just need God. These are the mindsets that keep people sick. They're anti-recovery, and they're deeply at fault for thousands of people who decline real help in favor of unproven methods used by untrained people, even when those people are well-meaning. The gist is, see someone with an education in mental health. Don't expect people who aren't mental health professionals to solve mental health problems. That's all I really got today, and I'll see y'all in the next one. Hadeh.
I stare at the populace in prayer.